Viewers, you are welcome to Koyeb Ranch. In this video, I'm going to share information about cattle health. The presentation is going to cover best practices for cattle health management, monitoring and assessment of cattle health, and some common cattle diseases. Maintaining cattle health requires a proactive, multifaceted approach, focusing on prevention, nutrition, biosecurity, and regular monitoring. As a cattle producer, your key strategies must involve establishing a disease management plan in consultation with a veterinarian and implementing best practices for herd care. Best practices for cattle management. Among the best practices for cattle health management include vaccination programs. Vaccination is essential for preventing common diseases. Therefore, a tailored vaccination specific to local risks help ensure herd immunity. A vaccination plan which is tailored to suit the risk in your local environment with the particular disease or peculiar diseases in your environment. That will help ensure herd immunity. Another best management practice is parasite control. Regular deworming and measures to control external parasites like ticks and flies minimize infestations that cause stress and severe blood loss. Balanced nutrition as a best practice. A diet including high quality forage, supplements, and minerals strengthens the immune system and support the specific needs for growth, pregnancy, milk yield, and production of your herd. Stress reduction. Minimizing stress through gentle handling of the herd, adequate shelter from extreme weathers, and sufficient space in your feeding areas prevents weakening immune system of your herd. Regular health checks. Embarking on routine monitoring helps detect illness early. Observing the behaviors, their movements of your cattle, their appetite, and physical signs such as their coat quality, their eye brightness, nose discharge is crucial for timely intervention. Doing these regular checks is very crucial for you to intervene on timely. Biosecurity measures. Preventing the introduction of new disease is also vital. So therefore, your biosecurity practices must include quarantining new cattle that comes into your farm, restricting unauthorized access to people into your farm, and regularly cleaning and disinfecting your equipment. Monitoring and assessment. You always need to monitor and assess the animal. Monitoring the behavior. Healthy cattle are alert and part of a herd. They are always alert and form parts, moved together with the herd. So therefore, as farmer, you need to look for signs of illness like isolation, the cattle that isolate itself, lethargy or lack of alertness. You also need to look for physical signs. For physical signs, check for bright eyes. Their eyes must be bright. Clear eyes, they must be bright and they must be clear. Ears must be upright. Clear nasal passage, that is, the nasal in their nose must be clear. Signs of illness can include watery eyes. If the animal is sick, you can see watery eyes. nasal discharge, drooling, or noisy breathing. If it is breathing, you hear noise, that's drooling. Another monitoring measure you need to embark on is movement. A healthy cow moves easily with regular steps, with all 4 feet bearing equal weight. Lameness or slow movement can indicate injury or illness. You also need to monitor nutrition. Observe feeding habits and check for a sunken flank, which indicates a lack of appetite. Diarrhea or bloat are also signs of digestive upset. Grooming and body condition. You also need to look for how grooming and then body condition that the cattle, that your animal is. Healthy cattle have clean rear ends and a good body condition. Rough coat or poor body condition can signal the underlying issues. These are also the common diseases that are likely to affect cattle. There are numerous diseases, but the common ones, likely common ones. Cattle are susceptible to various infectious and metabolic diseases. Therefore, prompt veterinary advice should be sought for any unexplained health problem. Some of the example of cattle diseases that we have is foot and mouth disease or FMD. This is a severe viral disease causing blisters on the tongue, mouth, and feet, resulting in drooling and lameness. Another common cattle disease is bovine spongiform encephalopathy, BSE, widely known as mad cow disease. This is a fatal neurological order, widely known as mad cow disease. This is a fatal neurological disease caused by abnormal protein. Anthrax. Anthrax is a potentially fatal bacterial disease that can affect all warm-blooded animals, including human beings, typically by ingestion of spores. Brucellosis. Brucellosis is a contagious disease causing abortions in livestock and intermittent fever or undulant fever in human beings. Jones disease. Jones disease is a bacterial infection of the intestinal tract that usually affects calves but shows clinical signs years later, eventually causing chronic diarrhea and weight loss. Another common type of cattle disease is mastitis. Mastitis is inflammation of the udder or the breast. It occurs often as a result of bacterial infection, which is one of the most common illness in dairy cows or cows producing milk and can cause swelling. The udder can swell, painful teeth, and reduce milk production. Metabolic condition, that is another common sickness. Metabolic conditions. Issues like acidosis or low rumen pH due to high starch diets. It results as a result of low rumen pH. Rumen pH refers to the acidity, rumen acidity, due to high starch diets like grapes and grass starches, which is deficiency in magnesium. It can be managed with proper nutritional balance and supplements. This is the conclusion of my episode, and thanks for viewing. Bye bye.